Okay, welcome back to Dr. Chan's Minor Ailments Forum, and I've done two videos to talk about menopause and also did one on HRT treatment. So this one is non-HRT treatments for menopausal symptoms, okay? So not everybody is keen to have hormones really because, although they're very good in some cases, but they're not of no risk, especially cardiovascularly, and increase some sort of cancer risk as well. So some people like to do it naturally, and there are loads of things that you can try to do it naturally in order to help with your menopausal symptoms. Okay, so I'm not going through the symptoms again, but quickly having a quick reminder. So they're like hot flushes, feeling low, depressed, anxious, and sometimes forgetful as well. So obviously the treatment is targeted to different kind of presentations. So let's talk about hot flushes. So interestingly, the people who are on a particular type of antidepressants called SSRI, they've noticed that these women who are at menopausal age but who are also on SSRI tend to have no hot flushes symptoms or much reduced hot flushes symptoms. Then they realize that actually the side effect of being on an antidepressant is actually the treatment for hot flushes. So let me give you some example of what SSRI are. So for example, fluoxetine, like Prozac, is a type of SSRI. Also, the newer kind of medication would be like citalopram and duloxetine and so on and so forth. Now, these medication, actually, I used it quite often to treat women with perimenopausal symptoms, especially hot flushes. At the beginning, they kind of like quite skeptical, and so they should, because well, I'm coming in to see you with hot flushes. Why are you asking me to take antidepressant? Well, that's exactly why. It's because of the side effect of it helps the menopausal symptoms. And after they've gone through the skepticism and they actually tried the medication, a few weeks later they came back and said, well, no, it actually worked really well. And then that's, quite safe for them to continue if they don't have any side effects, okay? And also, as we mentioned earlier on, if you are going through the change, sometimes you might feel a bit edgy, you feel a bit, well, just not quite yourself. And you'll be surprised how this antidepressant can help you on a low dose. And mentally speaking, not just hot flushes, they tend to feel better as well. So that's one thing that you can consider if you do have symptoms like that. There are other medication that also help with the hot flushes symptoms. For example, gabapentin, which we normally use it to treat people with epileptic fits, somehow has got that kind of effect on perimenopausal women as well. They do have less hot flushes reported. And obviously you can also try lifestyle changes. For example, sitting in a cool room, wear something that's more breathable, like cotton tops and stuff like that. But sometimes it just doesn't work without something extra like a tablet. Some people might want to try something more natural, no tablets at all. Then some people might think about soya products. And the funny thing about soya products is it has got natural estrogen called phytoestrogen. And the people notice that if they do drink or eat soya products like tofu or soya milk and products like that, they have a slightly reduced symptoms on the perimenopausal symptoms, especially with the hot flushes. So it's just a food. If you don't mind soya, why not give it a try? Obviously, there are other supplements like black kosher and dong guai and stuff like that. But although they are saying that they're natural product, doesn't mean that they don't contraindicate with the medications that you're already taking. So it's worth checking with the pharmacist or the health food shop to make sure whatever supplement that you're going to take are okay with the current medications that you're taking. Because you don't want to run into trouble just because it is said that it's natural, okay? And sometimes your symptoms might be quite localized. For example, you suffer from vaginal dryness, but you don't have any other problem. Your memory is good, you're not depressed, and you don't have hot flushes. Then maybe something like a lubricant would be the answer. You might not need to be on any supplement at all. Okay, so bottom line is, if you think that you're suffering from perimenopausal symptoms or you know that you're suffering from these symptoms, then you need to go and see your doctors to have a further chat and see what kind of treatment is suitable for you, either HRT or non-HRT therapies. Because I know that these symptoms are or can be very debilitating, and you don't need to suffer on your own, because there are helps out there that might be suitable for you. So I hope that this video is useful for you, and thanks for listening today. Thank you.